Well, absolutely. So in the theme of 3 take-home lessons. So the first is engineer the Cerner implementation to be modular enough to be agile. I mean, you heard from the various folks that I brought to the table that there are going to be these components that come and go, technologies that evolve, and they will be provided by an ecosystem of players. Some will be mobile apps, some will be voice apps, some will be cloud services, but there'll be a diversity of providers, and be able to plumb those into the Cerner implementation, take them in and out as you will. And if one doesn't work, put in another. And there should be very little friction to doing that. You know, you don't like this scheduling messenger reminder provider, plug in another one. It's completely fine. So very modular engineering agility, and you saw some of the connectivity standards we talked about. Second thing is meet the patient at the level of technology, comfort, and literacy. And a very quick story for you. There's a large search company. I won't mention which one. It asked me to take a number of engineers to the Medicaid clinics in Boston. And I brought these engineers, all 28 years old, wonderful, smart people. And they walk up to this homeless gentleman and they say, "What's your favorite wearable?" And he said, "Socks." Right? And it was so clear that the cool technology was out there and it could not possibly meet the patient at the level of technological literacy and need. And so that's fine. Sometimes we'll use voice. Sometimes we'll use phones. Sometimes we'll use paper. Sometimes we'll use fax. And all of these are probably a component of the solution. And then we said this many, many times yesterday. The technology, oh, it's cool, but it's really the workflow, right? And so I said this earlier today, that you could go hire all the vendors that I brought to the table today, and unless you changed your underlying workflow, none of them would help you. So as you say, it's a change management project. Think of requirements and workflow, and the technology will follow.
Eva?